Good morning, everyone. This video helps you to know about Tetralogy of Fallot, which is a congenital cardiac anomaly in children. I'm Saranya, Assistant Professor at Tripplum College of Nursing. So the objective of this video is to give you the proper definition of Tetralogy of Fallot, explaining the risk factors, incidence of Tetralogy of Fallot, causes, pathophysiology, clinical features, diagnostic evaluation, management, giving the complications, and the nursing diagnosis can be framed for Tetralogy of Fallot. So, as an introduction, tetralogy of Fallot is the most common type of a cyanotic congenital heart disease. So, very well you know that the congenital cardiac diseases are divided into cyanotic and acyanotic. The tetralogy of Fallot comes under the cyanotic condition. Since the first surgical repair in 1954, the treatment has continuously improved. Then, the treatment strategies currently used in tetralogy of Fallot result in extensive and excellent long-term survival. 30-year survival ranges from 68.5% to 90.5%. Definition of tetralogy of Fallot: it is pronounced as tetralogy of Fallot. It's a birth defect that affects the normal blood flow through the heart. It happens when a baby's heart does not form correctly as the baby grows, and it is developed in the mother's womb during pregnancy. Tetralogy of Fallot is a combination of four congenital heart defects. The four heart defects are: first one is the ventricular septal defect, that is an abnormal opening between the right ventricle and the left ventricle. Next coming the pulmonary stenosis, that is the narrowing of the pulmonary valve. And next is overriding of aorta. So the aorta has been overridden and thickened right ventricular wall or right ventricular hypertrophy. You can see in this picture, that is the first one is the ventricular septal defect, that is the abnormal opening between the right and the left ventricles. And coming to the pulmonary stenosis, the pulmonary valve is being stenosed, and next is the aorta has been overridden and the right ventricle is being thickened, that is hypertrophy of the right ventricle. So all these four is being as a combination of the congenital heart defects, that is the in tetralogy of Fallot you have the combination of all these four defects. So the first one, risk factors. So any viral illness during pregnancy such as rubella, and drinking alcohol during pregnancy, poor nutrition during pregnancy, a mother older than age 40, a parent who has tetralogy of Fallot, and the presence of Down syndrome or Dijot syndrome in the baby. So these are the risk factors which can give you tetralogy of Fallot. Coming to the incidence, in India, around 4 of 1,000 babies can suffer from congenital heart defects, and tetralogy of Fallot comprises of 7 to 32% of them. Causes, it is not clear, but still genetic causes, as I discussed earlier in the risk factors, Down syndromes or the Dijot syndromes, and child born to mothers with phenylketonuria, child born to mothers having alcohol during the pregnancy. These may be the extensive causes of tetralogy of Fallot. Coming to the pathophysiology, the blood returns from systemic circulation to the right ventricle, but the outflow is restricted from right ventricle due to the hypertrophy. So one of the defect is right ventricular hypertrophy. So the outflow is restricted. So the unoxygenated blood mixes with the oxygenated blood. Next, coming to the blood flow to lungs is reduced because you have pulmonary stenosis. So it is also one of the defect. Next coming, unoxygenated blood reaches the systemic circulation, which causes cyanosis in the baby. So the body attempts to unoxygenated blood, which is revealing symptoms of polycythemia, thrombophlebitis, emboli, and cerebrovascular disease. These may be the effects of the tetralogy of Fallot in a child. So because of the defects in combination, you can see these the pathophysiological changes in the baby. Next, coming to the clinical features. A bluish discoloration of the skin caused by low blood oxygen level, that is cyanosis. So you can very well know the deoxygenated and the oxygenated blood is being mixed in the tetralogy of Fallot, which is causing a cyanosis to the baby. And coming to the shortness of breath and rapid breathing, especially during feeding or doing an exercise. Poor weight gain, tiring easily during play or exercise, irritability, prolonged crying, heart murmur, fainting, an abnormal rounded shape of the nail bed in the fingers or a toe, that is clubbing of fingers you can see. So these are the clinical features of tetralogy of Fallot. Coming to the TET spells, that is some babies having tetralogy of Fallot will suddenly develop the deep blue skin, nails, lips after crying or feeding or even agitated. That is, these episodes are called as TET spells. TET spells are crossed by a rapid drop in the oxygen in the blood. Death spells are most common in young infants around 2 to 4 months old, and toddlers or old children might instinctively squat when they are having a shortness of breath. So, squatting increases the blood flow to the lungs. So, because of the mixing of deoxygenated and oxygenated blood, the child develops cyanosis. So, a sudden cyanosis or the sudden deep blue discoloration of skin, nails, or lips after crying is called as death splits, and this is more common between 2 to 4 months of old of age in the infants, and in toddlers and older children you can make the child to squat so that the squatting increases the blood flow to the lungs. This is how you can manage the death spells in older children. Coming to the diagnostic evaluation, first is the cardiac examination. So in the cardiac examination you can see the harsh systolic murmur in the left sternal border. And coming to the ECG, right ventricular hypertrophy can be witnessed. Next, in the chest radiograph, that is an X-ray, mood-shaped heart is being witnessed. In echocardiograph, with the 2D and Doppler, it shows VSD, that is ventricular septal defect, overriding of aorta, and pulmonary stenosis. Next, in cardiac catheterization, you can see a systolic hypertension in the right ventricle. Coming to the management. First one is the medical management. You give metoprolol, that is a beta blocker therapy is used to right ventricular infundibular spasm and place the infant in the knee chest position, giving prostaglandin E1 to improve the pulmonary arteries. These three are the major medical management which is being done. Going with the beta blocker therapy, placing the infant in knee chest position, prostaglandin E1 to improve the pulmonary artery. Next, surgical management. So the elective repair of tetralogy of Fallot is being done in 3 to 11 months of age. Coming to the palliative therapy, the first one is the beloctosic shunt. It is called as BT shunt in short form. So in order of infants and children, an artificial ductus is being created between the right or left subclavian artery to the pulmonary artery of the same side. So this will increase the blood flow to the lungs. This is being done by lateral thoracotomy. It is not being done by open. It is not a chest open surgery. It is done through a lateral thoracotomy. So a ductus is being kept in the connecting the right or left subclavian artery to the pulmonary. Next, coming to the Potts procedure. The upper descending aorta is anastomosed with the left pulmonary artery. Next is Watterson's shunt, side-to-side anastomosis of ascending aorta with the right pulmonary artery. Next, the Brock's procedure. Pulmonary valvotomy is done to correct the pulmonary stenosis. Coming to the corrective surgery, that is the total correction. It is called as intracardiac repair. It involves the open heart surgery which correct the defects, or a temporary procedure that uses a shunt. The shunt or the conduit is created between the right atrium to pulmonary artery. The conduit procedure is otherwise known as a Fontan procedure. Coming to the nursing management, you have to check the vital signs periodically. Auscultate the lung sound, as heart failure can cause pulmonary edema. Auscultate the heart sounds to assess for murmur. Palpate the pulses. Notings could be examined, it can be diminished or even absent. Monitor the patient's weight, intake and output chart. So these are the major nursing management to be performed. Complications. The child may go for complication of heart block or residual ventricular septal defect or residual pulmonary stenosis or pulmonary valve regurgitation. Coming to the nursing diagnosis, decreased cardiac output. So the cardiac output will be decreased, which may relate to complications. Then activity intolerance, because the child may go for exertion on doing activities. Then compromised family coping. So the child which is going and undergoing a treatment or a surgical management, the family coping has been compromised. Then risk for injury and risk for infection. So these are the nursing diagnosis can be framed prioritizingly and the care can be improvised. So far in this video, we have explained about the tetralogy of Fallot, which comes under the cyanotic congenital heart disease, which gives a bluish discoloration of the skin because of the low level of circulating oxygenated blood in the to the lungs. The severity of the condition is based on the right ventricle hypertrophy and the function. So the tetralogy of Fallot is managed by medically as well as surgically, and it can be treated well, and the life of the patient can be extended. So these are the references. Thank you.